There are some new theories today about the way that monkeypox is actually spread.
And it appears there could be more cases of polio than first thought.
Yeah, that's among the developments that we want to discuss this morning with Dr. Roy Gulick, the Chief Infectious Disease at Weill, Cornell Medicine and New York Presbyterian. So, Doctor, thank you so much for being here this morning. I think you're muted right now.
Can you hear us?
We'll get it situated. Live television, everybody.
Hi.
There you go.
Hi.
Thank you very much.
Good to see and hear you now, Doctor. So there's a report by NBC News right now that the latest research shows that monkeypox actually may be spread through sex itself and not this skin-to-skin contact that we've been told about as the means of transmission. What is your take on that?
We know that monkeypox is spread by skin-to-skin contact, and it requires intimate, prolonged contact for the virus to be transmitted from one person to another. Of course, sex is such a behavior where you have intimate, prolonged contact. So it's not surprising that people are beginning to focus on the fact that sex is a way that monkeypox is transmitted. But we can't lose sight of the fact that this is a virus that is transmitted through skin-to-skin contact.
Right. Yeah, just to be clear, it is not just sex that could lead to you catching it, right? Because that's important to note. Doctor, I want to talk about this because there is a vaccine for monkeypox, right? But there just doesn't seem to be enough doses that are available. Can the vaccine help someone who has already been infected, or does it have to be given beforehand?
Typically, we want to use this vaccine to prevent monkeypox. So either in someone who's been exposed but not yet developed the disease, or someone who's at high risk for contracting the disease. And we know right now that over 95% of the cases are in men who have sex with men. Yeah. So that's a community that needs to be aware of monkeypox and be aware that the vaccine is available and out there. And if people are at risk, they should get the vaccine.
All right, well, let's turn now to polio, because that's also making headlines now. We thought it had been all but eliminated thanks to the vaccine, which it's really been around for, what, 70 years now? But then now there's a young man in Rockland County paralyzed from it. And the CDC now says polio may have been in wide circulation around here for at least a year. So how come no one else has contracted polio?
So we do know that polio has been found in wastewater samples. So this is a virus that has been around. It's around the world. But the virus we're talking about is actually related to one of the two polio vaccines that's used around the world. The polio vaccine here in the United States since the year 2000 is an injectable polio vaccine and cannot transmit any virus. The one that is used in some countries around the world, or before 2000, and people may remember receiving this as a sugar cube when we were children, that vaccine does contain live virus, and that is no longer used in the United States, but in other countries. So potentially that virus over time can change and can lead to infections. We now know that that is the virus that the person in Rockland County was infected with, who developed the paralysis. So, paralysis is relatively rare. With this strain of vaccine polio, we know that it's only about 1 in 2,000 cases. But the concern here is we are finding the virus in wastewater. And that's a message that the virus is out there, and everyone should make sure that their vaccinations are up to date, including children.
So let's talk about that, right? Because I saw this circulating on social media. As soon as we broke the news about polio being in the wastewater, people were checking, saying, was I vaccinated as a kid? You know, texting their parents, was I vaccinated? How, and this may sound like a silly question, but it was something I just happened to see trending on social media, is do you have to get an updated vaccine for polio as you progress later on in life?
Most adults are fully protected, and schools require polio vaccination. Right. So if people attended public school, they can be very sure that they got the vaccination because it was required at that time. Adults who are at particular risk, and so most often this would be traveling to countries where polio is circulating, or working with the polio virus in a lab, or taking care of people with polio. Those adults are recommended to have one additional booster in their lifetimes. Aside from that, we're waiting for further recommendations, but most adults are fully protected right now.
Okay.
Kids require 4 polio shots. And so we need to make sure, particularly because COVID has decreased vaccination rates, that kids are up to date on their polio vaccines.
Now, we're running out of time, but I want to quickly ask you this because it's a concern a lot of parents have. Mask mandates have been dropped in a lot of schools. Okay, because the COVID-19 mandates have been dropped, so kids don't have to wear masks. But that means monkeypox, polio, they have very similar symptoms. And so a lot of parents are worried about transmission in schools because now they're not wearing masks. They're very close contact with the other students. So what would be, well, first of all, should parents be concerned? And quickly, what would you recommend? Should kids continue to wear masks in school?
So masks don't protect necessarily against either polio or monkeypox. Again, polio is spread by fecal oral, so someone coming into contact with fecal material. And as we've said, monkeypox is direct, prolonged skin-to-skin contact. So those two infections, again, we need to be aware of them. Masks are not critical in terms of transmission of either of those viruses.
All right, Dr. Roy Gulick, thank you so much. Chief Infectious Disease at Weill, Cornell Medicine, and New York Presbyterian. Appreciate your insight. Real helpful stuff this morning.
Thanks.
All right.